Well, it's a very awkward question. You know, in 2023, cream will never solve your demands in terms of, you know, smooth skin and volume replacement or issues with your scars and acne. There are a variety of the products that can be delivered to your face. Not important fact, with knowledge, right? If we are talking in the perspective when young male don't really have any issues with his skin, of course, he needs probably skincare. That will be enough. But on the other hand, we have people who are struggling with acne and other dermatologist diseases. There's another there's another group of people who is willing to change their appearance in a better condition, right? In a better way, with maybe some fillers and the threads, neurotoxins. So the answer is cream is not enough, excluding the fact that maybe you are a genetic phenomenon. Well, virgin lips, I believe, very fashionable now in terms of injectables. I would say Russian lips. It's a special technique where a filler injects with many spots above the vermilion border from here, right? With microscopic amount of product in a variety of directions. But what it does is actually makes the lip look more flat, like a flat bow. You should probably be educated at this point because, you know, lips are kind of very tough anatomy, and every woman and man has their personal forms and structures. So be really popular move for the past, I believe, like 4 or maybe 5 years is that people try to lip their lips with a filler, right? Instead of making haloplasty. Well, it's a surgical procedure. Haloplasty that is, like in simple explanation, shortens distance between the upper lip and the nose. So you get that reversing of the upper lip and face become more kinky, you know, more attractive, more youthful. You cannot actually replicate it with the filler because you add the volume. You don't cut the tissues. But in some cases, in right hands, with the right product, it could be done very accurately and aesthetically. Well, it's a great question for endocrinologists, my colleagues. Will probably give you more enrolled answer on this, but my recommendations is not to make, get rid of the bad ideas, you know, because this is very important period when in puberty person get his own personality, you know, and hormones could be provocative. Your testosterone levels increases dramatically high, and maybe estrogen if you are a woman. Become resilient. Don't forget about your home care and do blood tests, you know, to control level of sex hormones. Stick to your doctor who will check you, you know, your hormone status, and never ever take melatonin while you run into puberty. I had a video on YouTube. You can check this out. I told it before. And one more thing, guys, don't go for HRT, hormone replacement therapy, if it is not prescribed from your doctor. Give your body a chance for maximum potential. Use retinoids and good home care with exfoliating components. I think that's it. I never heard about it, but only in the yellow press. We have products in market such as placenta. It's like little ampoules. They call it Lanac or Corazon. Those are recombinant rich placenta plasma. It could be like delivered under the skin or intravascular. Those are very effective in terms of lightening the skin and acne therapy, which includes a huge numbers of growth factors like micro and macro nutrients. Well, when it comes to the option, look young, there's no answer on that, like you inject this and you erase your biological age. This is impossible, seriously. You know, aesthetic medicine is very multifactorial, and every patient and needed a personal medical approach. But anyway, I like the tendency which we observing right now in 2023, right? No wind blowing faces, no, like on the streets anymore. I see majority of people on BOTOX injections, neurotoxin, no overdose, anemic faces, that we had previously in 2000 when the filler just hit the market. Well, filler injections also can be done in enormous amount, like 1 liter or even 2 liters, delivered to the gluteus and to the buttocks. But well-known plastic surgery procedure is called Brazilian butt enhancement. This is something similar, but without getting a general anesthesia, right? And this is less traumatic, less soreness. Brazilian butt lift is a procedure where fat conglomerates is gathering with special liposuction cannula and delivered or transferred to the buttocks. Like, fat embolism is not something rare in medical practice, and there is very high percentages of fatality due to buttock anatomy and so on and so forth. Right? This alternative, the filler injection, is less soreness. It could be done under local anesthesia, less costly, and almost like no recovery time, like 3 days swallowing, and that's it. What about the cat-eye and threats? Well, you should factor in your head that what is more in today fashionable definitely will age poorly in the future. What are you going to experience negatively in the future, like within 5-10 years, right? So threats is aiming to be on a connective tissue production. They call it collagen production, which is a fibrosis. And fibrosis is bad. So what dermatologists actually do, they make a pinch, they took a small fragments of threads and they give it a little tension to the temporal or a lateral brow reposition, but it doesn't really work, and it only makes it worse, right? Because thread is not able to handle those structures, and eventually it breaks, right, and or fragmentizes to conglomerates, and you can see on people's face bulge and that hooded appearance. So, well, when you need a belly hadid or cat-eye or adenoma, whatever hell they call it, you better go for a Rowley surgery with orbital rim reposition, and you will get result permanently. Well, guys, it depends on many factors, but yes, you can go to maybe like for 5-10 minutes, even refer. Rarely, because guys, you don't even believe. Go and check the statistics for melanoma on Wikipedia. It's simply depressing, right? People don't use a sunscreen, right? There is a lack of education in that point, and the problem is that they cannot diagnose it, and on the early stage, that's a huge obstacle. There's a huge issue there. So melanoma, it's a skin cancer. So I definitely would go for some like between 9-12 o'clock in the morning, and when the sun goes down, and use medical products now, not a mass market, like not cheap solutions for a sunscreen with high rate of SPF. Well, BOTOX is a brand name. The company itself is called botulinum toxin. Well, it's a drug that blocks neuromuscular transmission. In other words, it's generated. It has been founded by a guy, Alan Scott, who is American ophthalmologist and eye doctor. Well, this product initially was used for an eye drops, drugs that cure blepharospasmatic diseases. His wife also, mentioned that drug can cure wrinkles, and then world finally met the BOTOX as a product. I use it every 3 months for my personal purpose for forehead and eyes. It's not a drug anyway, but once you try it, you see the results. Of course, there is no doubt that you will stop doing it, right? Logically. Second thing, it can be delivered only by a certified doctor with a medical degree, because it can cause you issues, even dramatic in some cases. I also use it for treating patients in a larger amount of doses for a patient with muscle activity disorders, such as cerebral palsy. Definitely yes, in case you just cut it out with a lancet. In other less worst case scenario, you should go for laser ablation treatment. Like PicoSure is very effective in that point. There is not a secret of success in tattoo removing, only systematically going for that procedures over time, visiting your practitioner or a doctor who is specialized in tattoo removal. But I really found with high rate of efficiency and feedbacks from my patient is that you get sessions of laser ablation, and immediately after you go for radio frequency wave therapy. It forces the pigment that lays into the dermis, and under it fragmentizes it to small pieces, and it's way faster than without it. Just take that into consideration. This is very useful for you. By the way, it's very high level of soreness. It's way too painful than getting a tattoo. There are zones on the body which are unbearably painful for and tolerate, so necks, like ribs, foot is ridiculously painful because I'm, a tattoo addicted person, by the way, and I can feel it on my own. There is no way to tolerate without a frost system. Of course, you can use an applicational anesthesia, but we usually don't use it. We use a frost system because anesthesia comes with the swallowing, the soft tissues, which prevents deep subcutaneous dermis revealing. Yes, you can, and there is a special term for that, consumer tourism. If you're a stupid-ass doctor, screwed up everything, you better get into negotiation with the patient, right, and find some civil ways of, solving that concern of issues. Well, don't exclude that fact that there is always path for solving it without the lawyer, which I definitely don't recommend. Go for it. It's hard to prove if there was no damage to the health, right? The answer is yes or no. Well, if you do constantly right procedures with educated person and right hands and products, you don't need Photoshop at all, believe me. Well, preferably in a medical university if you want to practice in the legal field. Russian and Ukrainian degrees are not very popular among the medical community, medical society. Spain, Italy, Romania is less costly and is compared to English or United States universities, right? Well, guys, there is no barrier, seriously. Well, average, it starts from 10,000, depends on where do you practice, to it can be rise up to 200,000 bucks a month. Well, if you're running your own dermal clinic and you have a team. Well, usually dermatologists update their level to facial plastic surgeon, right? As I did. Majority of surgeons, majority of them loses initiative to a handcraft and switches to business entrepreneurship, as I did 2 years ago. Most of my colleagues created their own brand of cosmetics, goods, maybe clinics. It's kind of frustrating tendency. Some of the doctors, I'm not kidding anyway, changes their scope to e-commerce, and they don't want to do medical practice anymore. This is terrifying, seriously. I love helping people, wish their happy faces, smiles. Looking good is great, but feeling good is priceless. Anyway, what I really see is that, not my personal exaggerating delirium at that point. When you changed your face and body to better condition, you can see how people, developing a pattern of loving and accepting yourself for every day. They woke up, they stand in front of the mirror, they say, oh my God, I'm a so attractive girl, some attractive guy. Of course, it developed a habit, and people around you, wealthy and success is it's around you for everyday move. Too many talks, too many psychological work with the patient. My friend once said a very catchy phrase. He's a face plastic surgeon, by the way. If you don't have to talk and convince so much and deal with personality deviations, but just keep delivering injections, operate them without dropping a word from the mouth, it would be the best profession in the world, no doubt. Well, go for anatomy courses anyway, and never stop updating your knowledge. Well, choose right hands, not Instagram profile. Educate yourself and understand what's going on in the beauty market. Don't go too big. Don't go too small. Always stick to the golden ratio. Bye.